Good morning to everyone. I am Sajina. I am working in Emmanuel Arisa College of Nursing. Today we are discussing about myocardial infarction. Introduction. Acute myocardial infarction is the medical name for a heart attack. A heart attack is a life-threatening condition that occurs when the blood flow to the heart muscles is abruptly cut off, cause tissue damage. This is usually the result of blockage can develop due to a buildup of plaque substance mostly made up of fat, cholesterol and cellular-based products. Next, definition. Myocardial infarction is the disease condition is caused by reduced blood flow in the coronary artery due to atherosclerosis and occlusion of an artery by an embolus or thrombus. Next one, types of MI. First, anterior or septal wall MI, obstruction of the left anterior descending artery, LAD, result in anterior or septal wall MI. Then second one, posterior or lateral wall MI, obstruction of the circumflex artery, result in posterior or lateral wall MI. Then inferior wall MI, obstruction of the right coronary artery, result in inferior wall MI. Next one, etiology or causative factors, non-modifiable. The etiology factor divided into two types. First one is the non-modifiable or modifiable factor. Non-modifiable factor, the age is more than 40 years. Then family history, myocardial infarction can be inherited from the parents to children. Then gender is 3 times more in men than women. Then next, modifiable factor, high blood lipid level, hypertension, smoking, physical activity, obesity and diabetes mellitus and stress. Next, pathophysiology of the myocardial infarction. According to the atherosclerosis and arterial septum and atherosclerosis or thrombus, they have to leads to the ischemia. Ischemia means decreased blood supply to the tissues. Then ischemia leads to the hypoxia. Hypoxia means reduce the oxygen level into the tissue. Then leads to the reduced oxygen demand. They have to cause to angina. Then thrombolysis or they have to cause for the unstable angina. Then permanent thrombus, they have to leads to the necrosis, total cut off blood supply into the myocardial tissue. Then next one, clinical features of the myocardial infarction. Then cardiovascular symptoms. First is the chest pain. The main symptom is the chest pain. Chest pain occurs sudden, severe, immobilizing chest pain, not relieved by resting position, changes and medications. Locations, substernal and retrosternal or epigastric region. Duration more than 15 minutes and not relieved by nitroglycerin drugs. Then radiation, the pain radiated to neck, jaw, shoulder, upper left arm, downward for the 4th and 5th fingers. Then bradycardia means decrease the heart rate, hypertension, increase the blood pressure. Diaphoresis means increase sweating. Then dysarrhythmias. Then respiratory symptoms, shortness of breath, pulmonary edema, chest heaviness. Other symptoms and include increased sweating, weakness, nausea, vomiting, lightheadedness, palpitation, anxiety, chest pain is less in women. Then common symptoms are weakness, fatigue, dyspnea, fever, 100.4 to 102.2 degree Fahrenheit. It is due to inflammatory process caused by myocardial cell death. Next one, diagnostic evaluation. Diagnostic evaluation, first we have to collect the history collection of patients. Second one, physical examination. Third one, ECG changes. The ECG waves, ST segment elevation, T wave inversion, appearance of wide, deep U waves. Then next one, X-ray chest to detect pulmonary congestion or cardiac enlargement or cardiomegaly. Blood test, certain heart proteins slowly leak into the blood after the heart damage from myocardial infarction. Example, CKMB level elevated 2 to 4 hours after infarction and peak at 48 hours and return normal more quickly, so it is used to diagnose infarction. Both troponin I and T level elevated within 2 to 4 hours after infarction and peak at 48 hours and stay elevated for 7 to 10 days. Next, myoglobin serum electrolytes means potassium, sodium, also they have to check, and blood sugar level, ABG level. Then echocardiogram, it is useful to assess ability of heart muscles to contract and relax. It is done to evaluate ventricular function by checking ejection rate. The next one is the angiography. Angiography is used to detect abnormalities including narrowing, stenosis or blockages in the blood vessels called occlusions. This is done by injecting a radio-opaque contrast agent into the blood vessels. This is the day makes the coronary artery visible on X-ray pictures. This is helps to doctors see the blockage in the arteries. Next, CT scan, painless imaging test that uses X-ray to take many detailed picture of heart and blood vessels. It produces high quality pictures of the beating heart and can detect calcium or blockage in the coronary arteries. Next one, nuclear trace imaging, an imaging method that uses radioactive material to show how blood flows into the heart muscles, both at rest and during activities. Next one, the management. Medical management, they have including drug therapy, surgical management, general management and lifestyle changes. Drug therapy, antiplatelet drugs, decreased platelet aggregation and inhibition thrombus formation.